John, how we doing?
Daniel, excellent. How are you?
I'm doing very good tonight.
So, hopefully, we are going to be able to get started here in just a few minutes. Tonight's presentation is Daniel Botkin discussing mobility training. So it's really about different ways that we're going to be able to look at mobility training utilizing the device and make this a really worthwhile endeavor for our patients.
And Rob can't join us tonight. He's actually out traveling the world. Just finished doing some setups overseas, and he's currently traveling. So he's not going to be able to join us tonight. And John, I understand you just came back yourself from some travels.
I did. I just came back yesterday. I was in Athens. I was in Egypt for 12 days. I was in Italy and then finished my presentations in Paris and got home.
Very
So
nice.
it's been a kind of a whirlwind for the last 3 weeks. How's the baby?
Baby's doing well.
Very
The new
nice.
one's 6 weeks old. The year and a half year old Ellie or Lily, she's doing well. Good
Very
transition.
nice. Very nice.
Absolutely.
So one of the things that we always want to make sure is to kind of welcome not only our attendings here in the United States, but we know that we have a fairly large international group that's kind of joining us. And while they may not be able to listen to us at this moment, they kind of add on afterwards. So welcome to everyone. Please be sure to include any of your instructions to us. The other thing is that I know that we have some people joining us from the United States Armed Forces. So first of all, thank you all for your service. It's very important for all of us to make sure we acknowledge that. And again, anything that we can do for you guys, please make sure you let us know. Questions are welcome. You can send us questions. We'll be more than happy to review them and also talk about them on the next webinar
All
at
right,
that
you ready to
aspect.
get
So
started?
yeah, I am. It's
All
all
right.
yours, man. I'm going to take myself off
Same
and
here.
mute myself and make sure that you are all gone.
Okay, before we get started, I want to invite everybody to like us on our social media. So head over to our pages, give us a like, and share our content. Also, if you have any questions for us, send them to rob.potash@csmisolutions.com, and he can direct them to John and me. These help us guide our future episodes, and they give us good questions for the end of our lectures. Once again, I want to give a shout out to Eric Mara and JW Matheson at PT Inquest. If you haven't checked out their weekly podcast, I invite you to look them up. They do a great job of presenting current research, and they keep it fun at the same time. In episode 1, John covered the history and science of isokinetics. Last month, I demonstrated the various treatment and testing applications of an isokinetic device, but without all the detail that you're going to get today and in upcoming episodes. So today I'm going to discuss the mobility phase of an isokinetic plan of care with research and demonstration. On the right side of the screen, you can see our schedule for upcoming webinars. Now, when we look at the overall plan of care or continuum of care for a patient, you can see how an isokinetic dynamometer can be used throughout. But today we're focusing on the first phase, which is just restoring the mobility and motion. So when a patient walks into your clinic or athletic training room, you need to ask yourself, what does this patient need? So here I have a flow chart to answer this. First, ask yourself, does this joint or body part move or move appropriately? If the answer is no, then we travel to the right of our chart and we ask, well, should it move? And if that answer is yes and it's not moving, then we need to get that thing moving so we can get to our happy place. And this is the path that we really should take to get that happy place. Now, I've heard before that what we're trying to do with isokinetics is reinvent the wheel, and that it's a bad thing. But if you think about it, we've reinvented the wheel many times over. And unless you're Fred Flintstone, the wheels on your vehicle, they've advanced a bit over the years. And so here we actually see Fred reinventing the wheel. And he's also getting to his happy place as well. So when we think of CPM, this is usually what occurs. It's an unskilled patient at home on a machine, on the bed or couch without proper alignment, moving the hip and knee simultaneously. The patient's wiggling around. They don't have a good way to increase the range of motion as needed. But when we compare it on the right to how we're going to use it, it's properly aligned. It's single joint motion. There's a skilled therapist who can adjust the speed, the motion, they can put in stretches, and they can do that as that joint loosens up. So yes, we're comparing apples to apples, but that's like comparing the Golden Delicious on the left with the Honey Crisp on the right. And if you've had a Honey Crisp, you'll know what I'm talking about. So now let's look at how CPM actually works. O'Driscoll and Giori published this article in 2000 out of the VA, and they looked at the various stages of stiffness. And they have identified 4 general stages of bleeding, edema, the formulation of granulation tissue, and finally fibrosis. And they found that the use of CPM applied in the first 2 stages have a beneficial effect and can prevent the joint from progressing to the latter 2 stages. So bleeding distends the joint capsule, and each joint has a point in the range of motion that the capsule is lax and the volume of the joint is maximized. And we know that as the open pack position. For the knee, it's about 35 degrees, and this is where our patient will hold that knee for comfort because it puts the least amount of pressure and pain in the joint. So CPM can act as a pump to the joint and the surrounding tissues as it moves that joint back and forth, increasing and decreasing the interarticular pressure in a sinusoidal fashion, and that's displayed on the graph on the right. Now this clears out hemarthrosis and blood from the joint and the surrounding tissues. So what they did to show this was they injected 2 cc's of blood into the knee joints of rabbits. They casted one side while they ran the other on CPM. At 48 hours later and 7 days later, the knees of the casted joint continued to have a significant amount of blood, but the CPM side was clear. So I'm just picturing Bugs Bunny laying on a CPM machine. Also, I don't know how much 2 cc's of blood is for a rabbit joint and how that compares to a human knee. And always keep in mind, animal studies are not directly relatable to humans, but we can make predictions from them. The other effects of CPM are that we stimulate the mechanoreceptors and we inhibit nociceptors. It increases the blood flow to local tissues and it circulates synovial fluid to bathe the joint surface. It prevents excessive scar tissue by applying a controlled load to prevent the shortening of developing scar tissue, ensuring the proper fiber alignment and reestablishing the tissue length. All right, let's look at some research. Brahm et al. Looked at the use of CPM and the incidence of arthrofibrosis after ACL reconstruction in the pediatric population. There were 163 subjects that were placed in either a CPM or a no CPM group. And 4 patients in the no CPM group, and that equals out to 7.4%, they had to undergo manipulation under anesthesia, but none of the patients in the CPM group did. Jaspers et al. Published in the Journal of Orthopedics and Trauma Surgery out of Germany. They published a systematic review and meta-analysis of CPM after ACL reconstruction, and they found that CPM has beneficial effects on pain reduction during the first 2 post-op days, on knee flexion during weeks 1 through 6, and on swelling in weeks 4 through 6. For Achilles tendon repairs, an injury 2014, Bruman et al. Performed a systematic review, and their findings recommend that starting in week 2, we begin controlled ankle range of motion to 0 degrees of dorsiflexion. They also recommend that we combine this with immediate full weight bearing to get maximal effect. Also, Sorrenti published in Foot and Ankle International in 2006, where they took 64 patients that were treated with a protocol of early weight bearing and early mobilization, and all resumed to normal activities in an average of 3.3 months. They concluded that early mobilization reduces range of motion loss, increases blood supply, and reduces the degree of muscle atrophy that typically occurs after Achilles tendon rupture. Moving on to the shoulder, both Mazaka et al. And Mazaquin et al., and I'm sorry if I butchered those names, they found that early mobilization was beneficial for small and medium tears, especially in post-op phases of rehab. While there's no difference in long-term outcome for your patient, if you can mobilize the shoulder safely in the early phases and reduce pain, that's beneficial for your patient. Now, just a little side note, these were not looking at CPM directly with the shoulder. They're talking just about early mobilization overall, so keep that in mind. So who can benefit from mobility training? We've discussed our post-op patients so far, but your typical patients with arthritis, sprains and strains, tendinopathy, they all do really well with passive motion. This really helps reduce that joint or tissue stiffness and pain, and it's really good to use as part of your warm-up or cool down in the session. You can even have your patients who are further along in the rehab process use passive motion as a rest break between their stabilization or strengthening sets on the machine. Now we have some rules for putting a patient not only on CPM, but generally on an isokinetic machine. First, John has always had the rule that a clinician who's new to the machine or a student, they always perform at least 10 setups and exercise on fellow staff members before they put a real patient on the machine. And this is especially true when they're post-op. Next is patient consent. You have to tell your patient what to expect. They see a machine and it can be a bit intimidating unless you explain the treatment. So if you're not getting permission, you have to, tell them what to expect with it. And I just threw this in here for all my Game of Thrones fans because we only have a couple more weeks until the final season. Finally, make sure to give them the safety switch if you're not going to be directly at the machine with the patient. Now, before we move on to the treatment videos, keep in mind that an isokinetic or dynamometer training is only part of the rehab plan of care. It's a piece of the pie. So here I have Dinosaur's recipe book to demonstrate this. And actually, it's just a setup for my lame dynamometer joke. I always think the best jokes are the ones that you have to explain afterward. Moving on. All right, next, we're going to see videos that show software navigation, patient setups, passive motion, the exercise screen, how to expand the range of motion, some active assisted techniques, and some soft tissue techniques with passive motion as well. All right, so this is our main exercise screen. We're going to click on dashboard. Now in the dashboard, we have the pattern box, and here we have the 4 most common patterns. But if we click on the pattern button, now this is going to give you every pattern that you have on your machine all in one place. And I'm just scrolling down to show the various ones you have. Now you have the joint, the action, and then any modifier. So we're going to go up and click on knee, extension, flexion without a modifier. All right, next we have the setup button. So this gives you all the settings for the basic setup. Here at the top, the most important thing, these are your range of motion stops, your mechanical safety positions. Now for this pattern, that's going to be TLG and black M. So these are all the adapters or accessories that you're going to need for this pattern. And every pattern is different and it has a setup for every single pattern on this machine. So you can click on the picture just to, if you're not sure which adapter that is. And it even has a general picture of what it should look like. Now these next settings are going to be for the chair. So first is the chair rotation. We're going to set this to teal 40. And that's where the indicator is underneath the chair. Next is the back angle. It tells you to set it to 85 degrees. So lift up the handle and pull back until you get to the right indicator. Next is the fore aft position. And again, these are all settings for your general patient. You're going to align the patient up to fit them perfectly. So you can see where the indicators are for the back angle and for fore aft. All right, next is the back translation, and this is left blank because you set this to the patient. So you just turn the wheel on the back and that adjusts it for you. Here's our indicator here on the back of the chair. The seat position for this pattern is up, so just lift up on the front side of your chair, and that'll lock it in place. These next settings are for the dynamometer. So here we have Dynatilt. So with one hand, grab on the dynamometer, and with the other hand, loosen up the wheel on the side, and then lock it in place. And you can see the indicator of the angle here. Next is the dyna rotation and the dyna height. So you set these both at the same time, lift up on the handle, so you can lift the dynamometer and you can rotate it in place. So we're gonna set it to teal 40 and a height of 8. So you just push the handle down to lock it in, and here's the setting here. All right, next is the monorail. We're gonna press down on the plate and slide it up to 38. Lastly, we have a place to put the length of the adapter that we place in. So just lift up on the knob and tighten down. These last settings are for if you have a Johnson anti-shear device. Now, if you need help with either of these, you can click here, and this help button will actually guide you through the setup process for this pattern. It tells you step by step how to get your patient on here. There's another help button here, and this is giving you general information about the different settings. And every screen in the software has a help button that tells you exactly what is going to be on any screen at any time. So somebody who's new to the machine can easily learn it. All right, so next in the dashboard, we have the feedback section. So we have options of CPM, isometric, isotonic, and isokinetic. Now we're going to go with CPM. The second box on the screen is for your action. And this is going to be for concentric, eccentric, flexors, extensors. Next, we have speeds, and then if we have any torque limits we want to put in. Now, notice you don't have an option for this, the number of reps or a time limit from this screen. But if we click on the mode button, this will give us the option of setting it up to run CPM for 10 minutes, 5 minutes, or you can do a certain number of reps. So let's click on mode. So in the top left, you can see the settings again. We're going to go with CPM. When you do this, your settings change. You notice my screen changed here. So now at the bottom, I can actually set how many reps or minutes that I want this to run for. So let's go ahead and just set this for 8 minutes. I typically like to set the exercise to run longer than I expect. That way it doesn't stop on me when I'm not expecting it to. So if I want to run them for 5 minutes, I'll set it for 8. If I want to run them for 10 minutes, I'll set it to 15. Now up here we have the speed. Now you notice how it has extension on the left and then the box on the left. So the left box is to set the motion moving into extension or lifting up, whereas the second box is moving into flexion. So that's moving down. Now you can always click this arrow and that sets the speeds the same. I'm going to run this patient starting at 5 degrees per second. Here we can set torque limits. Now, given that it's CPM and they're not going to do any exercise, there's no need to make any changes with this. But if you were running them on a stabilization or a strengthening and you wanted to limit their torque, you can always put those in here. And that's set for concentric and eccentric limits. At the bottom, we have a pause, and this is where you can add a stretch. I like to add this in after it's going, so I always start it out at 0 second stretch for each flexion and extension. And on every option on here, it's a drop-down menu, or you can always click it and type in. Now, this is a maximum range of motion limit. This is kind of like a digital range of motion limit. So let's say I have a patient who's only allowed to go 90 degrees of shoulder flexion. I could put that in there and set it as a protocol so for immediate post-op, just so I have a secondary safety put in. The cushion here is just how soft the change of direction is. And this option here is ramping, so you can start the speed slower and ramp it up over the course of a minute. You don't do this. I always start it out slow, and then you'll see in a moment how we can increase the speeds as we go. So I do my own ramping. All right, we have our settings ready to go. So let's go ahead and click on the OK button at the bottom. All right, next is our feedback. And this just gives you different options for exercise screen feedback. You have torque versus time and torque versus position. Those are the two that you're going to use for CPM or for most of your stabilization strengthening. Now, if we go to the top of the screen, this is where we're going to set up our patient. So first, we need to set the side that the patient's going to be on. So here's our patient here. Let me introduce him. We were working with this young man for about 3 months after his ACL reconstruction. He was a lacrosse player at the local university. He went home for the summer, and while he was home on summer break, he was getting irritation to the medial knee. So he went and saw a surgeon and found out that the screw wasn't actually placed properly. So the doc went ahead and took the screw out and adjusted it. So he's back, and this is his first visit. So I want to show you the setup. It's really important that we set them up correctly. And you can see how the arm of the adapter is not aligned with his tibia. And I'll demonstrate that with the line. You can see that the tibia line is slightly off. We want that to be exactly parallel. So all you got to do is slide them in. And this is how I like to line the knee. So now we have complete parallel tibia to the movement arm. All right, so the next setting, we need to set the height of the dynamometer. And we want the axis of rotation to align with the axis of the joint. So that's right at the lateral epicondyle. And you can see with my line, currently we're a little high. So just drop that down. Now, when you align it, you got to make sure you put it right back on TL40. That way it's the same angle that the chair is in. So it's always good to palpate. That helps get the proper alignment. Take a little bit of time with your alignments. It's not necessarily with CPM. If you're a little bit off, it's not going to be that big of an issue. But when we get into some of the strengthening, if your axis is off, you're going to put some wear and tear into that joint that you don't need. Lastly, you can see here that our patient is too far forward as the axis is going through his thigh. So all we have to do is move the fore-aft position. Now, I noticed he was out a little bit, and John has a rule that you always align proximal to distal, but I failed on this setup here. So I just had him slide back in the chair. And now you can see that the axis is going right through that lateral epicondyle. All right, so our patient's set up now. Now I'm just strapping him in. Now, normally you wouldn't need to do this for CPM, but he is lacking full terminal extension. So I'm going to put the thigh pad on. That way, as it lifts him up into extension, his whole thigh isn't going to lift up. That way we can mobilize him into flexion, but we also work on that terminal extension as well. Now, because we're doing CPM, you don't have to worry about that proximal pad placement because he's not going to be pushing up into the pad. So you can go ahead and put this down low on the ankle. Now, always run the patient through the motion a couple times before you actually start the machine, just to make sure everything looks good. All right, so we're going to set up the right knee. Now, here you can see a picture of the range of motion of your patient. So as I'm moving his knee up and down, you can see the little line moving. So you can see he doesn't have full extension. So when I set his anatomic 0, I have to denote that he's 10 degrees off. So I'm going to put that he has 10 degrees, and when I click the Set AZ button, it's going to align the computer to be exactly at 10 degrees. If he had full extension, I would have kept that at 0. And some people like to set this at 90. All right, now you can see as I'm moving him up and down, that more accurately reflects the true motion of the knee. So next we're going to set the range of motion for the exercise. So we're setting full extension that he has. So I don't want to make it uncomfortable. I'm setting it to where he feels comfortable. And you can see the 2 red dots. That means that we haven't clicked those yet. So once you get him at the angle you're going to set it to, just click the extension button. When you do that, the red dot turns green. And we also have a 10. Next, let's set his flexion. And again, set it for comfort, right at the point where he feels tight. Click the flexion button. Now I have 2 green dots. Now I have to click the set ROM button. When I do that, it gives me the mechanical stops for his motion. This is the most important part of the setup. Now these are the mechanical stops it gave me. In case anything ever happens, your machine loses power, you get struck by lightning, there's an act of God. It doesn't matter what it is. If those mechanical stops are in place, nothing is going to happen to where that dynamometer takes off. All right, so after you have those set, click the Set ROM button, and now you can click Start for the exercise. All right, so here's our exercise screen. What we're looking at is it's plotting the range of motion versus time. All right, so I'm walking around the side of the screen, or side of the machine, to give him the stop switch. Now, if I'm going to be with that patient the whole time, I typically won't give it to them. But if you're ever taking off, you need to give them that stop switch, okay? That way, if it's uncomfortable or they need to stop it, they get apprehensive, you can stop it at any time. All right, so again, here's our exercise screen. And again, I lied. I said it was plotting range of motion versus time. This one is looking at torque on the y-axis versus time on that x-axis. And all it's giving us is the weight of the limb. It tells you the reps that have been completed in the sets. You can also get the range of motion bar on the right side, so you can see how far it's going to move. You even get a dynamometer status in the top right corner as well. At any time you need to stop, you can click the bottom right side of the screen for cancel. And we're just going to let this run on that patient for up to 8 minutes or 10 minutes or 5 minutes or whatever you feel is appropriate for them that day, as long as it takes for them to loosen up. So you can just see it running them back and forth here. All right, next, I want to move on to show you how to do the range of motion expand. All right, so we're going to go into the same dashboard. Only thing that we're going to do differently here is for the pattern, we're going to set it up in the knee extension, flexion, and prone position. Now, I'm not going to take you through the full in-depth setup, but I just want to show you that it is different if you click on here and you can get all your settings. Let me fast forward this for you so we can get on to the exercise. Okay, so we're going to set it up the exact same way. CPM. I'm going to run it for 10 minutes with this patient here. I want to use the same slow speed. Now you can see the picture of the range of motion on the screen is different as well. So here we have our athlete, and she's actually a ballet instructor, and she tore her ACL when she made a bad landing jump. So today I'm going to mobilize her in the flexion position, sorry, in the prone position, just to get a little bit more flexion out of her. Not only that, she again doesn't have full terminal extension, and you can treat the prone CPM almost like it's a prone hang. Now, one thing I like to add that the normal setup doesn't is I like to support that uninvolved limb. So I just put the secondary adapter in the pad there. That way it holds the uninvolved side in place. So again, you can see me kneeling down, checking the alignment of the dynamometer with the axis of rotation of her knee. Now, the nice thing is they have the settings they give you in the software. It puts you in the general ballpark. Then all you have to do is make tiny little adjustments for each individual patient. Now, the thing I like about this is you can see on real patients. It's one thing when you have some of the videos where we're setting up on each other and doing the exercises, whereas in some of these, we have real patients, so you get their real reactions that you wouldn't get when you have a model teaching you in a course. So what I'm going to tell her to do is to lay down flat. So let's set the anatomic 0 for the exercise. I'm just running her through the motion. I want to see generally about where we are. And always get their feedback. Tell them to let you know when it's starting to feel tight. That way you don't take them into too much motion when you're setting them up. All right, and again, I'm going to start her at 10 degrees. Let's set the anatomic 0 at 10 degrees. I'm going to click extension to start it there. I'm going to move her through flexion. You can actually see here, I take her a little bit into it, and if you watch her face, she's letting me know that that's as far as she feels comfortable going. So I back it down a few degrees before I click flexion. So let's click the set range of motion. So now it's going to show you, or I'm going to show you on the bottom of the screen, the expand range of motion options. So we use the expand range of motion when we want to increase the range of motion with through the exercise. So in the flexion side, I'm going to click either 0, 10, 20, 30 degrees as a maximum that I can expand it throughout the range. So I'm just going to click 10 degrees. Now, when I do that, that changes my mechanical stop position. So let's click start. Move it into the position to start the exercise, and then it's going to run. And again, CPM on these machines is very comfortable. It's the same speed, it's the same range, every rep. It's actually pretty soothing, not just to the joint, but to the patient. So right now it's just moving her back and forth. Before I expand it, I want that joint to loosen up with a few repetitions. Now, as she tells me that the knee, that tightness is reducing, that's when we can go over and start making some adjustments. So here we have our exercise screen. All right, so she's telling me that it's starting to loosen up. So let's make some adjustments here. Now let's pause the screen here so you can see what I'm looking at. On the bottom of the screen, we have the range of motion limits. First, it's what the dynamometer was originally set to. The second column is where your patient currently is. And then the third column where it says expand, that's the maximum that will expand to based on what you clicked in the dashboard. And we only clicked for a maximum of 10 degrees expand. So this is where you can increase or decrease the extension or flexion respectively. So let's go ahead and increase her flexion. Now I only ever do a couple degrees at a time. So instead of bringing her to 63 degrees this time, it's going to bring her to 65. And every time you find out how it was. And she told me there, it felt fine. So let's get her another couple degrees. So originally she was tight. It's already loosened up. We've already expanded her up 4 degrees. So as it flexes her, we're going to find out how it feels. Now let's say you clicked it and it's too much for them. It's a little bit painful. You can always back it down a degree. Now she told me right here that it's tight. It's right on that edge. So we're not going to move it any further, but we can go to the pause section, and this is where we can put a stretch. So it felt a little tight to her. So let's put a stretch on that flexion. So anytime you click a button, it adds 1 second. So I'm just going to put a 5-second stretch. I usually do between 3 to 5 second stretches here. Now, when you see us mobilizing the shoulder in the next video, I always leave a 1 second pause at the end of the range of motion of the shoulder just to reduce or make it more smooth. All right, so it's holding her there. She said it was tight but comfortable. So now we just have a different view of the knee. So now over the course of treatment, what I like to do is I like to use this specific angle for a couple reps before we move on. Even if she says, okay, it's loosened up, I wanted to run it through a couple reps, and then we increase your range of motion as we go. Now, anytime I increase the range of motion, what I'll do is I'll take that pause all the way back down to 0 before I increase it up. Lots of times they'll say that, you know, the stretch feels good, the range of motion isn't bad, but maybe it's too long of a pause. So maybe 5-second stretch is too much. So we might just back it down a degree or two. So there you saw it held her in that position. So again, I got rid of the stretch. Now I'm only increasing her flexion at this point. You can also do the extension at the other end of the range. Now the middle box right there is for speed. You can always increase or decrease the speeds. Let's say you're only trying to mobilize them into further flexion. Well, you can always speed up the motion going into extension. And typically for a large movement joint like the knee, you can have their extension go, that motion go 10 degrees per second, but you want the motion that you're trying to increase to be slow. What you saw me do, I was just decreasing the amount of extension she gets. So instead of it running her all the way to 10 degrees each time, I'm just going to have it run, you know, to 40 degrees. So I just really want to focus on that flexion angle. Here's a box highlighting the speeds. For smaller joints, such as the ankle, you're going to use a much slower motion. Maybe 3 degrees per second to start, maximum of 5. It's a smaller range. So if you use 10 degrees per second on a smaller range joint, it's going to feel very fast to the patient. So keep those slow. And that's the range of motion expand. If any point your patient is starting to get sore, let's say you've increased the range 15 degrees and that knee is starting to become uncomfortable with it, back it right back down. early on, you're not trying to hit a home run. You're just trying to get on base. Maybe make it to second base. You're not trying to get a home run. So don't get over eager with your range of motion expand. All right, next, I want to show you some different joints treatments. All right, so I have this in here just to say again, the safety stop switch. And I think this is a really funny video of John and his acting. I think he picked the right career. All right, let's start with the ankle. Now, a lot of people are intimidated by the ankle. They think it's a very complex setup. I was debating whether or not to show you the whole setup of this patient because it does take me about 2 minutes. It's actually usually a little faster for me, but I'm trying to do the setup from the opposite side of the machine so that way I'm not blocking the view. Yeah, once you get good with this setup, the shoulder setup, the elbow, it only takes you a couple minutes to knock it out, and it's not that complex. But again, John has that rule, 10 setups before you put a patient on there. And after 10 setups, you're going to be able to do these very quickly. So our athlete here was a high-level high school wrestler, and he got slammed pretty hard on his ankle and had a high ankle sprain that required a surgery for the syndesmosis. At this point here, we were preparing him to get back so he could wrestle in the state tournament. We all know mobilization of ankle injuries early on is key. The mobilization on the machine for the ankle feels outstanding for your patients. It really loosens it up much better than what you're going to get with your standard, sitting using a tilt board, doing heel slides, using a BAPS board for mobilizing. So there's the setup. Already got him in, everything's lined up. I'm setting his anatomic 0. I'm setting his range of motion. So it's a very quick and easy once you learn how to do it. Again, I'm looking at his reaction when I'm setting his range of motion. That way I'm not taking him too far into the motion here. All right, and like that, we're off and running for ankle CPM. Now I have him just running at 3 degrees per second. Again, it's a smaller joint. There's less total range of motion, so you don't want to run this at 10 degrees per second. That's too fast for the smaller joints. Here we can go up and zoom in on that ankle. All right, so for plantar flexion and dorsiflexion, we mentioned earlier that, for after Achilles tendon repairs, you can start them mobilizing them as early as 2 weeks. You only want to take them to neutral if they have it. If they're stiff, don't take them all the way to neutral. Again, take them to where they feel comfortable going. Now, there's 2 different positions for plantar flexion, dorsiflexion. Here, I have them in supine with the knee flex, which is actually going to put less tension through that Achilles tendon. Here I have my patient in the prone position so that the knee is extended, and now that's actually going to put more tension through. So for your Achilles tendon repairs, start them in supine with that knee flexed. Let them get used to mobilizing in that position before you take into prone with that knee extended and locked out. All right, here we have CPM for ER/IR of the hip, and any of your hip patients with hip osteoarthritis are going to absolutely love you if you put them on this treatment. It takes a very stiff and sore hip and loosens it up quickly. Here we see shoulder flexion. And again, this is good for your post-op patients. Keep in mind any of your range of motion limitations that you have with your protocols. I always mobilize a shoulder by myself manually the first couple times. I'll even do it on the table of the machine. That way I get a feel for how that shoulder is moving that day. Just like the ankle, once you get good at the setup, it doesn't take you long to do. Bradley's clicking the machine here to increase the range of motion. And I want to give a thanks to Bradley and also for Chris Fernandez, who's our patient in this video here. They've done a great job of getting videos back and forth to me, helping me out putting these together. Now, if you just have a general shoulder stiffness, tendinopathy, arthritis patient, and you want to loosen them up that day, ER/IR is your way to go. It's a much faster setup. It's easier to do. And it really loosens that shoulder up and reduces that pain quickly. And yes, you could simply throw them on a pulley. Absolutely. And we do that lots of times to start them out. But we'll put that on there before we run them through the range of motion. That way we can get a bigger range of motion for stabilization training or strengthening. Here we have one of our patients who had Tommy John surgery, and we're mobilizing his elbow. Now, he is not immediately post-op in this video. You will have to stick to your range of motion limitations, and I have him going all the way through the motion. Remember, you can have somebody that's later on in the process, and you're using that as a warm-up, a cool-down, or between sets. Next, we're going to look at active assisted. Here I have a patient who had a patella fracture. It was at 5 pieces, and we're trying to get his flexion back. So this is active assistive. He's stuck at about 65 degrees of flexion. I'm having him pulled down into flexion as the machine is moving him through the motion. Not just with the knee, the flexion, but let's say you have somebody who is limited in active extension. You can have that machine run them through to full extension as they're trying to lift up into it. And the screen just shows you how effective they are at doing it. If my line stays on the right side of the screen, it means that he has overcome the weight of that tension or the resistance of the tension. If it moves to the left, right where I'm pointing, that shows you that last part of the motion he's not able to. This is great to use with your patients to get their shoulder flexion or external rotation back. It's moving them into flexion that they don't have on their own, and they're trying to move with it. All right, next we have what John has called eccentric unloading. So the machine is lifting Bradley up at the top of the motion. John's cueing him to engage his quad and lower down slowly. Now, if you look at the adapter, he's not resting on the strap and he's not pushing into the pad. So not only is it taking him into full extension, which our patient here won't have, but it's teaching him proprioception of moving with the machine, not going too fast, not going too slow. And we can look at the screen to tell us, if we can't visually see it, we can look at the screen and it'll tell us, if they're unloading the weight of their limb. Here we have eccentric unloading for shoulder external rotation. So it's a great mobility trainer, but this is also a really good way to transition your patient later on into eccentric loading. Right here, his rotator cuff is having to unload the weight of the limb. So before I'm going to progress him into eccentric training against an external load, I want that muscle to be able to control the weight of the limb itself. So it's a great transition point to get them to that next phase, even if they have full range of motion. All right, lastly, I want to show you a couple soft tissue techniques that you can use with CPM. So here I'm using the Hawk Grips tools for instrument-assisted soft tissue mobilization. You can do this. I also like to use some passive release where I'm just putting pressure on the hamstring as it's moving it back and forth. I like using active release with this as well, to where he's producing just a very light eccentric load into the pad as I'm doing like a pin and stretch or an active release technique. I have not used this with my jigsaw massager yet, but I recently got the jigsaw massager. I love that tool. My patients love it, but I haven't hit a hamstring with it while on the machine yet. I think I'm going to stick to my my thumbs as well as the tools on that for now. All right. So again, for that software expand on your exercise screen, that's the bottom of the screen. So again, you can adjust the range of motion, the speed, the pause, or the stretch on the fly and get that increase in range of motion. Okay, that is it for our presentation today. I want to invite John back to where we can go over some questions.
Thank you, Daniel. That was an excellent presentation. A couple of serious takeaways for us, I think, for everyone to kind of review is one is when we're talking passive range of motion, we want to keep it slow. It shouldn't be moving at 20, 30, 40, 50 degrees per second. We're really talking about 5 degrees, maybe 10 degrees if we're going through a 80, 90 degree range of motion, and it should be very comfortable. So one is, if in doubt, slow it down. That's going to be the one thing that we want to pay attention to. Second point is what you mentioned, and I thought was very good, is that we can add a 1 second stop at the end of the range of motion to kind of give them a soft changeover, or what we call a soft stop. So as they're going through range of motion, it just stops for 1 second and comes back. That way it doesn't kind of just automatically move them back and forth. Patient actually understands what's coming. And again, with anyone that we might have that's apprehensive, they're going to be able to appreciate that. So again, questions, we love your questions. Be able to kind of send them into us. We'll be happy to answer any of those questions. One that we did have, Daniel, really comes, I think it's very appropriate, is how quickly would you start a total knee patient into beginning range of motion?
With most patients, actually, I'll start them immediately. In the eval, go in, get your history, take your objective measurements, talk with them about the plan of care, talk about the treatment, teach them their home exercise routine, and then we'll take them to the back, get them on the machine, and get it moving very slowly and controlled. Really does a good job of loosening up that joint to the patient, but they see the benefit that you're providing them. You're not just running them through their same routine that they're going to be doing at home, and they really appreciate that, and it loosens up that knee really well.
It does, and that's what we see over and over again. So, the key component is what we're really trying to go over on a monthly standpoint is that this is a tool, it's a multi-tool. It allows us to do mobility. We're going to look at stability, we're going to look at strength, we're going to look at control, and ways that we can functionally use this in the future. So, we're giving you opportunities to kind of to share this information back and forth. And again, any questions, any answers that you have, if you want to contact me, feel free to email me at john@pro-activephysicaltherapy, kind of one word, .com. If you need assistance with someone coming into your facility to kind of learn the system, to bring you up to speed fairly quickly, we can help set that up. Daniel's available to do that. Some of our other therapists and trainers are available. So if that's something that you're interested in, we'll be more than happy to do that. Next month, we're going to be talking about isometrics. We're going to be moving on from that to isokinetics and isotonics. We hope that you guys are enjoying this. One of the things that we do want to do in the future is kind of bring a baseline educational tool online with this so that we can do continuing education courses associated with that. So let us know if there's questions you guys have that we can help out with, and we're hoping that this is helping everyone to utilize the machine on a more effective basis. So until next month, Daniel, I'll say thank you very much. Great
You're welcome.
presentation. We're kind of looking for it. Rob, we hope that you're going to be able to join us next month. And for everyone out there, have a very good night. And we look forward to seeing you next month.
Have a good night.
Take care.